In this video, we will be extracting tooth number 46 or tooth number 30 for our American audience. And we will be implanting a zirconia metal-free implant by Zsystems. This is a Swiss manufactured implant. I will be using a two-piece system. This particular implant has its platform almost at gum level or a little below. Before we do the procedure, we have completed a CBCT, a 3D analysis, and we have planned our implant. And it's best if the roots of the tooth we're extracting are far apart. To orient myself better, I will be performing the osteotomy before I remove the roots. That is so that I can have a better reference as far as the roots are concerned, and also to avoid slipping into these sockets, which will be cleaned out thoroughly to remove all traces of tissue, and will also be grafted using a particulate graft mixed with PRF, which is taken and spinned from the blood of the patient. The portion of this blood will contain a high concentration of growth factors, and it will also help stabilize the graft, so it turns into bone much more efficiently.
Do you have many patients like that?
Access is created using moderate speed with a surgical burr, big enough to clearly visualize the bone in the furcation area. To adhere to the planned depth of the implant, I have to carefully measure the distance from where the furcation starts to the top of the tooth, and I will have to add 12 millimeter to that distance, so I know exactly how far to drill with my pilot drill. We follow the standard sequence of drills, and in this case I took a second X-ray measurement to make sure that I have a confirmed reference point. Therefore, I will be going at least 3 more millimeters to make sure that I'm well beyond the apex, so I get good primary stability in my implant. Through the whole drilling process, I have to make sure that I angle the burr about 10 degrees to the lingual, and I stay centered between the adjacent teeth. A conservative flap is laid without any vertical release incisions. Here I'm using the piezo med by W&H to conservatively remove as much bone as we can before I drill through the roots and extract them separately. And here I'm demonstrating how the piezo will never harm soft tissue. As you hit the gums, nothing will happen. It will only cut into bone. The PRF is harvested from the vials. We will make at least a few membranes and 1 or 2 plugs, and some of it will be mixed with the graft, which is a hydroxyapatite based graft, Osbone, from cerasorb, and we will create a sticky bone using the PRF. The implant, as we said, is a fully metal-free ceramic implant. It's made of zirconia or zirconium dioxide. It's a ceramic, and it will be inserted into the socket at a torque of 32 or less Newton centimeters. I place a PRF membrane to fill in the void in the immediate space around the implant. And after the implant is placed completely, I will also place the graft in the sockets around the implant and cover the whole thing with 2 more PRF membranes.
Even from this side, I can see how you were sewing whatever that is that you use to stitch.
Yeah, we stitched it with, it's called PTFE. It's a little bit like Gore-Tex, so it's very
Like
friendly.
shoes.
In a way, but it's a very tissue-friendly substance. It doesn't accumulate plaque.
Or even from this side, with my eyes just a little bit open, I could see how you're so at ease with doing that. You're really good. I could see that. I was like, oh my God, he's just like a magician just sewing up.
Yeah.